My name is Dr. Gaurang Krishna. I'm a hair transplant surgeon at Medlinks. In a hair transplant, we take out hair from back of the scalp, side of the scalp, sometimes the body, beard, which are what we call the permanent hair roots, and we implant it on the bald areas. So this is hair transplant. How we take out these hair from the donor area, that differs. So the conventional way was to take out a strip, take out a tissue from the back of the scalp and then individually chop hair out of this tissue block. This was named the FUT, or the follicular unit transplant, and which was popular for many years. Then came the era of FUE, follicular unit excision, whereas instead of cutting a big strip, we take out each hair graft, which is a group of hair follicles, one by one. So that is follicular unit excision. Now the reason for this shift, see, FUT was working very well, but the reason for this shift primarily was better patient comfort. Just imagine a big piece of tissue taken out from your scalp and then stitched. Of course, it hurts a bit more. The scalp feels very stretchy, very tight, and it can also give you a very unsightly linear scar. To eliminate these problems for better patient comfort, faster recovery, less pain, and to avoid that linear scar, FUE technique was developed, and over the last, I would say, 8 to 10 years, it has become very popular. So much so that in an ICHRS survey that was done around 11-12 years back, 80 to 90% respondents said that they FUT only, and only 5 to 10% patients said that they do FUE either alone or along with FUT. In a more recent survey that was done 2-3 years back, 60 to 70% respondents said that they do FUE exclusively, and then the rest either did only FUT or did a combination of T. So you see this paradigm shift that has happened over the years, that service providers, surgeons, and patients both prefer FUE technique over the FUT, not because it gives us a better result, but because it is more comfortable procedure. The problem that we faced with FUE was there was a lot of storage outside the body. And we already knew, research had proven it, that for every hour of storage, for every hour that a hair spends out of your body, there is a 2% loss in volume. And beyond 6 hours, which is the golden period for any human tissue, the hair grafts, the hair follicles, they start to die. So not every hair that we were implanting was growing in the FUE technique.